There you go.
Okay, we're good to go.
Okay, as a hi everybody. I'm going to just read the script. As a preliminary matter, this is Dorothy Hertz, Chair of the Contract Review Committee. Permit me to confirm that all members and persons anticipated in the agenda are present and can hear me. Members, when I call your name, please respond in the affirmative. Linda Williams,
Aye.
John Balosh,
Aye.
Bert Johnson,
Aye.
Brooke Moore.
In attendance, I'm channeling Brian Turbot.
Joanna, how do you say your last name, please?
Roach.
Roach. Okay. And is anybody else here? Jericho
In attendance.
and
Ruth.
and Median.
Is Ruth there? No?
No, I do not see
Okay.
her here.
Okay.
Anticipated speakers on the agenda, please respond in the affirmative. We do not have anybody. Good morning. This open meeting of the Contract Review Committee is being conducted remotely, consistent with Governor Baker's executive order of March 12, 2020, due to the current state of emergency in the Commonwealth due to the outbreak of the COVID-19 virus. In order to mitigate the transmission of the COVID-19 virus, we have been advised and directed by the Commonwealth to suspend public gatherings, and as such, the governor's order suspend the requirement of an open meeting law to have all meetings in publicly accessible physical locations. Further, all members of public bodies are allowed and encouraged to participate remotely. The order, which you can find posted with the agenda materials for this meeting, allows public bodies to meet entirely remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation unless such participation is required by law. This CRC meeting will not feature public comment. For this meeting, the CRC is convening by video conference via Zoom app as posted on the town's website, identifying how the public may join. Please note that this meeting is being recorded and that all attendees are participating via video conference. Accordingly, please be aware that other folks may be able to see you and take care not to screen share your computer. Anything that you broadcast may be captured by the recording. All supporting materials have been provided members of this body are available on the town's website unless otherwise noted. The public is encouraged to follow along using the posted agenda unless I note otherwise. We are now turning to the first item on the agenda. Before we do, permit me to go over some ground rules for effective and clear conduct of our business and to ensure accurate meeting minutes. I will introduce each speaker on the agenda. After they conclude their remarks, the chair will go down the line of members, inviting each by name to provide any comment, further questions, or motions. Please hold until your name is called further. We don't really have to go through that because we don't have any guests, but please remember to mute your phone when you're not speaking. Please remember to speak clearly because it helps generate accurate minutes. For any response, please wait until I yield the floor to you. If members have any wish to engage in a conversation with other members, please do so through the chair, taking care to identify yourself. So the following does not really apply to us, which allows for, after we speak, to allow for public comment. Finally, each vote on this meeting will be done according to roll call. Hi, everybody.
Hi.
So I'm calling the meeting to order. I'm establishing that we have a quorum. And by doing so, I will have everybody identify themselves one more time. So, Linda?
Yep.
John?
In attendance.
Bert?
Here.
Joanne?
Here.
Brooke?
In attendance.
Hi, Jericho? Jericho?
I am here.
Hi. Anne, I'm just saying that you're here.
Yeah, I'm here.
And Dorothy, I'm here. Can I get an approval of the agenda?
So moved.
So moved. Second.
All in favor?
Aye.
Aye.
Let's
Roll
say
call.
roll call. I'm doing roll call. Linda?
Yep.
John?
Aye.
Bert?
Aye.
Joanne?
Aye.
Brooke?
Yep.
We are going to do a little bit of discussion on the grants we received. And what we want to do is if there are any questions in regards to the grants, we'd like to answer them, especially Joanne, you are new to this. So if there's any questions you have, we will discuss that. And yeah, so Joanne,
Yes.
do you have any questions in regards to any of the grants that were submitted?
I guess to start with, how are the approach in terms of looking at the total dollar amount, is that the budget from the town and then the marijuana tax, or is it all, or are you looking at it all as a whole?
No, there are two separate things we have right now. So we have 3 grants that are separate grants underneath the marijuana tax.
Yep.
We're looking at roughly $100,000, and those 3 grants will be looked at separately.
Okay.
It's just that we will be doing the same process for the marijuana grant as we do for the CRC grant. Okay? Okay.
And if I may follow up on that very briefly, if an agency is presenting twice, once for each grant, I'm sorry, if an agency is requesting twice, they will present twice.
Okay, that was going to be one of my other questions. And then just also about the marijuana tax. So this is what number year is, how many years have we had that money to disperse?
This is our second year.
Second year, that's what I thought. Okay.
Yes.
And who got it last year?
NAMI to start this program that they started,
Okay.
which is going into, it's beginning January 1st. It will go into full swing.
Okay.
It took them a while to hire, to get a clinician that they could hire and have on island.
Right.
So, do you have any questions about any of the grants that were brought forth?
No, I read them all. I'm
You're
gonna, yep, I read
Thank
them all.
Does anybody else have any questions? Linda,
Nope.
John,
No.
Bert,
No.
Brooke?
I have one really nitpicky question that just piqued my curiosity. In the Safe Place financials,
Mhm.
in their budget, they increased the line for client needs by 50%. It's not a big number, but it begs the question, what is client needs? I would just love to ask them and have them prepare. I'm curious, not so much that the money's a problem, but I'm just curious what that line means for them.
Okay, I think we'll send out an email and request that.
Okay.
The one thing they did shoot out to me, which I brought to the attention of, it was between Jericho, Ann, and I, is that Fairwinds in their application did not submit number 15, which is the salaries as defined with, as accordance with what the grant is. We have requested it. We got an answer back that was not a sufficient answer. So we have now requested a second time that we have a more detailed answer to that. Brooke?
So it's really interesting to me in a community this size. I mean, I realize this is public money, but I think it warrants asking the question about publishing individual people's salaries and how that interplays with human resources within an organization and privacy. And I don't know whether there's a way for us to better balance the individual privacy with the need to know what their compensation structure is for the purpose of evaluating their grant application. By way of example, I'm the treasurer of my church, and we made a decision a few years ago to compress the individual salary compensation on the annual financials, in the interest of individual privacy. And I don't know, I just think it's worth a conversation in this group about what's appropriate.
Well, wouldn't the
It's
question
different.
be that it's a town grant with town money and all
Yes.
other town employees, their finances, every single salary of a town employee is posted? And
Yep,
they're
and they
usually
have to do a
accurate.
10/990. You cannot
Excuse me,
get
Linda?
away from it.
Linda, hold on a minute, please. And they're, in doing so, they're asking for town tax dollars. For, it's not being privately funded, it's being funded through public dollars. Some of the grants. So I think that we have that right to that access. I believe that we don't post it. It's not something that we post, but it does sometimes make a difference in how we look at things. And so I personally believe that it is a valuable tool in what we've done.
So
May I interject briefly?
Yeah.
In the
Yes.
previous years, during these grant submissions, the wages were included in the packet, correct?
Correct.
Would it be acceptable to do a by position as opposed to associated directly by name? So we know that there is at least a fig leaf covering the specifics of how it's broken down?
Well, usually it is broken down by either position, or they can do it either way. It's salaries based on what position they're holding. Sometimes we've seen dramatic changes in certain personnel within an organization, and we've seen a change in requests for funding for services. But are those services, are they requesting more money for the services because their salaries went up a dramatic amount as well? It's a clear balance there that I think we're owed that in making decisions. I think it's different than on the private sector. I think on the private sector, that is private information.
Yeah, no, I understand. I mean, I'm not trying to, I'm just sort of wrestling with it in my head, because I also know there are challenges in hiring in some of these organizations, and relative to private practice where there's more privacy. And is it in some way a disincentive to someone to work at one of these organizations versus being in the private sector? I'm just trying to think through all the consequences of, and then, so the other question I ask is, if the grant is not related to the salary, if they're not asking for public money for a salaried position, does that necessarily? I'm wrestling within my head. I'm trying to sit in the shoes of someone who's working in one of these organizations and wanting, in a very small community, to have a modicum of privacy. I don't know.
Dorothy, my hand's up here somewhere.
Linda, I'm sorry, it's not showing, and I apologize. Linda? Oh, well, you know what? I'm going to go to Joanne first because I did see her hand, and then I'll come to you, Linda.
Okay.
All right, so the salaries, aren't they all listed on the 990s anyway?
Yes, that's my
Okay,
point.
so they're public
So-
anyway. Okay,
They're public anyway. I mean, it doesn't say the name necessarily. It might say the name of the officers, but whatever they filed last year at the end of 2020, we can look it up, or they
Yeah.
can provide us with a copy of that.
Well, yeah, and I think it's important to realize that it is part of the contract, and we usually don't have a problem getting this information.
Well,
Right.
I think to Brooke's point, I will agree with her. I think that I think there's a lot of hiring challenges in this particular area right now, and some of it has to do with reimbursement rates, and some of it has to do with people who went to private practice, who used to work for places, and yeah. But I do think that the information we need is available in the 990.
Linda?
Yeah, and that was my point, because CPC requires the 990s. Anything that's going out with public funds requires a full disclosure, What we don't see at CPC and what we're not going to see here necessarily is that the name of the person in the position. It just says this position is funded such and such, and this position is funded such and such, regardless of who's in the position. Because we're not funding a particular person. We would be funding a position. So they're required, 990s are required for any money that's coming out of this, whether it's us or the CPC or any other entity in the town.
I think this discussion, though valid, more on Jericho and I talking with higher ups, because I think everything that's in this contract has been given to us by and looked over by legal. And there are requirements on public funding and how it goes out, public funding for private grants. So I would tool that Jericho and I will look at this a little further and get back to everybody. I think that getting the roundabout about this is,
Yeah, I would, my only real concern about this is that it has differed. This is a different thing that has happened in previous years. I would like to not have the precedent established that people cannot list that their any sort of granular data about their staff prices, because I think that's both an important thing for us to know when determining how and what to grant people, and also is an accountability measure as well.
and I think for me, and I'm just going to make this statement for some that haven't been here, we had a tremendous problem with Fair Winds on transparency, and worked very hard to get transparency out there. And when we begin to see that transparency might not be there, that is not a good sign. And I just think that we fought as a organization for the town to have full transparency with Fair Winds. They asked for a tremendous amount of the money, and I think transparency is extremely important within this process.
Dorothy, if I'm,
Brooke, yeah, I don't know why it's not showing me people's hands, but I am
well,
sorry. I see
Yeah.
I see people's hands once in a while, but I don't see them, they're not showing. So,
yeah.
Brooke.
So thank you. I really was asking from a philosophical and policy point of view, not specific to this application. I totally agree. This is the standard that's been in place. I was just curious about the background in terms of the policy, and I just wanted to raise this question from a umbrella level, not a handle level.
Okay.
So thanks. I appreciate the feedback. I'm not wedded to an answer either way. I was honestly just curious.
On mute.
Joanna, did you have something to say?
Well, the other question that I had is just when I read through all the packets, not some places did list salaries and positions, but not everybody said who the person was,
Right.
right?
And they shouldn't.
So I'm a little bit, what is the standard, right?
The standard this is what it's for anything over 25,000. Sorry, I'm going to my phone to read this because it's where I have the document. So if you see my phone, guys, that's what it's for. Give me 1 minute, please.
No problem.
I think the general standard is that the position,
This
as Linda
current-
mentioned, go ahead.
Oh, sorry, go on.
I was going to say that in general, the town is funding or partially funding the position. So we don't need to know necessarily who is in that position. We just need to know what that position is paid.
It says it's Article 15, question 15, number F, list of current staff positions with salaries and benefits.
If it's relevant.
If it's over $25,000 grant.
Yeah.
Okay, so that's what applies.
Okay. Anything else on any of the other packets?
Is there, so just because I am new, so
Yes.
just, can you review the process? Right, so all these people, this is my understanding, all these people are gonna come in and make a presentation to us. And then we're gonna discuss what we think of the presentation and determine who gets the money for two different categories or two different funds. The marijuana tax fund and the human services fund.
Correct. So what we will look at the 3 for the cannabis separately than the
Yep.
other grants, and they will all come in and discuss with us and we'll deliberate.
And is there like a grading system, or do you have like a metric that you like to use? And do you have some historical data on who you feel has been more successful than others? I mean, I know.
Yeah, so if you wanted to, if you want us to go over some of this with you right now, this is what the discussion could be on these packets. And I think that what we will do is there'll be a main form.
It's not my point. It's an organization.
Somebody needs to mute.
Yeah, hey, John, you're on speed. We can hear you, handsome.
Yeah.
So we'll send out a graph of how we've funded in previous years. So what we look at, Joanne, is when taking the grant, what did they do within that grant that year? Were they successful within that grant? Did they exceed what was asked of them within that money of that grant? How does that grant support members of the community, and what significance is the support in the community that they're providing?
Right, okay. Okay, I think that would be helpful. I mean, because in some of these grants, when I read through them, it was hard to tell what the programs actually were, right?
Okay, so do you have questions on them, and then we could help you with that?
I mean, I felt like what could like, I feel like it would be a better use for me to listen to the people and then have the questions,
Okay.
right?
Oh yeah, I didn't know if you had questions for us.
No.
Okay. So we'll make sure that gets out to you.
Okay.
Okay, that's what Linda was asking about when we first started talking today.
And then the only other thing that I'd share is that I know that from the finance committee over many years, one of the things that has come up there, and I know, Dorothy, we probably spoke with you about this a couple of times, is the hospital piece of this and how they fit in. And then also the idea, I know, and this might have been a Stephen Morey thing from years back about, is it better to fund one or two people to a large amount or several people to smaller amounts? And how is the determination made of who is most, how do we determine who gets served to the highest and best need?
Okay. I think what you will find is that every single one of the process that we have done for you over the years has been done with who does. Giving some people small amounts of money doesn't necessarily give us the programs that we need, that are in need. And I think that historically, I am proud of the fact that I believe that we have all funded the programs that have needed it and provided the services requested. I know that the hospital came up a couple of years ago. A discussion was not only with Steve Morey, it was Denise Cronow, and there were a few of us within the discussion. They were putting a warrant article out at
Yes.
town meeting. They had usually applied for money for social services. And what happened one year is they were applying for social services, the department got a lot smaller. And I did a lot of research within what was happening in social services departments owned by Mass General throughout the state, and found that some of the things that the town was funding were mandatorily being provided at every other hospital. And so why were we funding a program that actually wasn't doing what the old social service department did, the one that was under Peter McKay?
Right.
And so we had increased our funding of Peter McKay's office, as his office had provided numerous amount of services to members of the community. And then what we were finding was that we weren't getting the same services any longer, and that they were, of course, mandated services anyway within the government of the Mass General. So the question came in that they were out there, and how could we look at this as it's a funding the ambulance is to be funding behavioral health ambulatory care and some way of providing that care and primarily that care.
Mhm.
I've been in discussion with Jericho over a little bit of this year. I have to go back to the table with him because I read something incorrectly and want to go back over it with him, which I sent him a message this morning about. And, there is a significant amount of funding goes for behavioral health. The one thing I would like to find out in a little bit more detail in looking at the ambulatory care is if they're telling me they're spending that, could they tell me where the ones are going? So I get a little bit verification that we're actually all going to behavioral health, because it's a lot of the ambulatory care is just behavioral health in some of the quarters. So even though they might tell us they transport 6, can you tell me where you transport? Did the
Right.
6 go to this location and this? So I sort of have a backup verification, because all we're doing is going with the fact that they're telling us they sent 12. Or
Right,
in
I
a quarter, they're not
understand.
telling me
Yeah.
they sent 12 to, this facility or that facility. And I think I would like, I personally would like a little bit better understanding of where it is, because in some months, it's only like, there's only a couple thousand that isn't, in looking at it properly. But yes, I mean, I think that's been an open discussion with everybody. I know that some town administration believes in, with you too, that maybe we shouldn't be funding an ambulatory service. But I think that we're looking at it as, for some, the only way we can get them to behavioral and addiction health. So.
This has been a subject of discussion for what, 2 or 3 years now?
Yes, it has.
It has. It's been an open discussion within not
Yeah.
only us. I know it was a big discussion with the finance committee. It's been a big discussion with town management.
We
And-
struggled.
Yeah, I think that all in all, what we're looking at is if we don't have the services, we don't have access to these services that so many need, and so many of them don't have the money to get themselves to these services. Behavioral health and addiction is a huge financial struggle for families.
Mhm.
And then you take it from being here and you add on that struggle of having to admit. So some of the places don't allow you to just walk in and admit yourself. You have to be admitted medically. So I think it's been a fine line, but we're trying to negotiate it both for the town finance committee and for ourselves. when we
Right.
go through it.
Well, thank you.
You're welcome. The only other one that I had a little question on, and this might go back to what Brooke was talking about a little bit before, is it came up in a discussion with a few people, is the merit pay that is under,
Yeah, now that we can't cover.
yeah, I just don't think merit pay is part of our any funding that anybody should be coming from town funds.
No, we don't do that at the CPC either, and we also don't do contingencies, and we also don't do certain other aspects of the pay schedule.
Right. So I just wanted to put that out there. Is there any other discussion about the grants received for the human service grants?
Not yet, for me.
Okay. Brooke, any?
Dorothy, I have an 11 o'clock that's immovable. And so I'm wondering if I could ask that we
Go to
do the
schedule.
schedule.
Yeah.
Move the schedule up on the agenda to make sure we do that with the most of us present, because I know John has to go shortly too to travel to an appointment. So
Okay, yes, we can, but can you just tell me so I can end this one? Do you have any questions?
no, I'm good.
Okay. Bert, do you have any questions?
No.
Okay. John?
No.
Okay, Linda, you said no. Joanne?
Nope, I'm good.
Okay. We will move up to the establishing our schedule, which is number 8. If everybody can pull out a calendar, please. I'm gonna mute myself for 1 minute. I'm sorry. Sorry, guys, my gas stove was just put on and I can smell gas, so I'd ask them to put on the fan.
Let you blow up.
Yeah, right. Does everybody have one in front of them?
Yes.
Yep.
Okay. Starting with the week of January 2nd, or January 3rd. So Joanne, what we do is we set up a schedule and then we reach out to the participants in the grants and we ask them to fill in spots.
Great.
So we have January, how is Monday, January 3rd look? And we try to avoid this Tuesdays and Thursdays because Ann does passports on those days.
I would not do Monday, the 3rd. For
Why?
those who are
Is
still,
everybody coming back?
yeah, for those who are still off or have family.
How about January 5th?
Okay,
Yep.
Does 10 o'clock work for everybody in the morning?
Yes.
Bert,
Yep.
you doing mail? John Balash?
That works for me.
Okay, Brooke?
That's fine. I have yep, the morning is great on the 5th.
And Joanne, you said yes?
Yes.
Okay.
How much time are we setting aside so I can throw up my calendar?
Yeah.
We'll try to set an hour, 2 hours probably.
Okay, great.
And then we're gonna go to Monday, the 10th. Does that work for everybody?
10
Okay.
o'clock again?
Excuse me?
10 o'clock again?
Yes, 10 o'clock again, please.
I will just be late.
Okay.
That's fine.
January 12th.
hold on. Okay. Oh, never mind. I just have COA on the 5th, but it's not until 1:30,
Okay. We will not do the 17th because I think that's
the holiday.
okay. We'll go January 19th.
Hold on.
I cannot do that day at 10.
Okay. How many people can do that day at 10?
Mm,
Joanne is a yes. John, yes. Bert,
Yes.
Linda?
what is the 19th?
Wednesday.
It's a Wednesday.
Okay. All right. At 10 o'clock still?
10 o'clock, yep. Monday, the 24th.
Fine.
Okay.
And we'll go to Wednesday, the 26th.
That's good.
Okay, and then if we need anything, we'll know by mid-January and we'll go through it in mid-January. So I'm gonna ask Ann to post to everybody that we will try to book the 5th, the 10th, the 12th. That's 2, 4, 6, and we probably need the 19th. For actual meetings with everybody. And Brooke, we will try to schedule the ones for the 19th with the ones that you are most comfortable with no questions to be asked. And if you have questions, feel free to submit them and we will make sure your questions are asked and you get a written answer to all your questions.
Yeah, I just have an hour at 10:30, so I can be there for the first half hour and the last half hour. It's just the middle hours already committed, so.
Okay. Okay. But if you have questions, we will make sure that that gets answered for you. Okay. Okay.
Great, thanks.
Okay. With that being said, is everybody okay? I'm going to go through this the dates and then ask everybody that they're okay. January 5th at 10 a.m., January 10th at 10 a.m., January 12th at 10 a.m., January 19th at 10 a.m., January 24th at 10 a.m., and January 26th at 10 a.m. Linda,
Yep.
Bert,
Yes.
John,
These are all gonna be Zoom meetings, right?
correct, sir.
Thank you.
John.
Yes, yes.
Joanne,
Yes.
Brooke.
Yes.
Okay, thank you. Joanne, one of the things that does happen during this process too, I should let you know, is that if we do try to meet with the organizations afterwards, there's always questions that come up that maybe can get answered, and two people will meet with them, talk with them, and come back and fill in questions. Sometimes it can sway the way we feel about things
Okay.
when we're on their turf and they're not so nervous about being on our turf.
Okay.
Okay.
Yep.
Okay. I'm
Yeah,
gonna-
that's going to be great this year because we hopefully won't be so COVID-y. So we can actually visit everybody.
It would be nice, wouldn't it?
Mhm.
Well, we went last year. We were just socially distant.
Yeah, we
Yeah.
did. We did a good job on some of them, yes.
Yeah, we had mass and socially distant.
Okay, I'm gonna go to the cannabis as we have 10 minutes left. Are there any discussions about the cannabis grant?
How much is it again? Do we know?
Yeah,
exactly?
it's roughly, well, we don't know the exact number, but they're telling us 100,000.
In addition to the four, whatever we always get?
We're getting 650, but the 100 is it has to be looked at in a different realm.
We have to
Do
give it a-
not look at the $100,000 into the same realm as the grants that are getting the 650. They are
Okay.
two completely different grant processes paying for two completely different programs.
different programs, but at least it takes some of the pressure off the 650 if some of those programs can segue into the 100.
You cannot.
No, but we actually want to make sure that most of the programs that they're putting in for funding are not the same programs that they've put into the other grant. I would say we do not want to look at it that way. We want to look at it at the grant itself and
Yep.
see whether the viability of the grant and what they're going to be providing. Am I correct, Jericho?
Yeah, and the criteria for evaluating the two grants is different. The first CRC money is going to be just general social good per dollar, whereas the ganja grant stuff is going to be all specifically targeted to substance abuse and downstream effects of substance abuse or substance use disorder.
Well, that would deal with ASAP and those guys though.
No, because ASAP is applying for something different. If you looked at the two grants, the grant for ASAP, NAMI, it's NAMI, NAMI
yep.
ASAP, actually is a different grant. The marijuana grant goes after the funding with the opening of the Gosnod facility and the program they're doing at Gosnod. So two
Right.
completely different things. I see John's hand up.
I have to leave.
Okay, bye, John. Take care. Thank you.
Merry Christmas, John.
Yeah, Merry Christmas.
You too.
Merry Christmas. Happy holidays. Can't believe we're saying this.
I love that man. So that there is a little bit of difference there, and I want to make sure that we keep that in perspective as we go through these as just two separate grants. Does anybody have any discussion about the three people that came in?
Yeah, I don't fully understand these programs, right? So this is kind of what I'm open to having them explain it when they come and meet with us. Like, I don't understand the relationship between NAMI and Gosnold, and I don't understand what service they're actually providing, right? I understand that they got the grant last year and that it took them a while to hire the clinician, but what is the program?
So the program is a counseling program for people that come back from addiction programs, addiction.
And it was not offered last year.
The position, it didn't even exist last year.
Okay.
So this was a grant that went in with NAMI with from what I understand with my discussions with NAMI, they fought very hard with Gosnold because personally, I really advocated for Gosnold within the town. to get this, when they first opened up, to sort of just get them and for people to understand, they never have applied for a grant, Gosnold themselves. Then Gosnold basically went AWOL. We didn't see them.
Right.
And NAMI went into this. NAMI is a very well-respected program, both on the Cape and Islands.
Yes.
And it went into discussion with Gosnold with the understanding of how the town was feeling about Gosnold at this point. And there has been a commitment made by the president of Gosnold and by Gosnold that this position will stay open and they will be working together. So now what's happening is the Gosnold office is open. From my understanding is NAMI is in the building with them now, in the Gosnold building, so that there's access to people 24/7 to make sure that they are getting connections to services.
So there's a person who is staffing the Gosnold office that's by the computer store. It's not closed.
It is not closed. There are two people. NAMI is in there. Two of the NAMI personnel are in there. And there is a clinician from Gosnold in there. The program begins January 1st.
Okay. And the,
Or January 2nd, I'm sorry.
okay, okay.
And we just got some information on it. From what I understand, because of the way it was set up with the original grant, the information went to Rachel.
Right.
Then Rachel was out and it got sent back. They reached out to Libby and Libby said that she would let Jericho know about the information, but it didn't really get to Jericho till after a discussion came in. And we just recently had them resend all the information back out to us. So they did come in within their period of time. It just didn't, it was not accessible because they were given, information that wasn't valid.
Right.
Brooke?
I just didn't understand that anybody actually worked there.
Yes, they just reopened it under this grant.
Okay.
Brooke?
So I would, given that there was no activity on this grant for at least the first quarter and probably well into the second fiscal quarter, I'm curious about the status of the last year's grant. It was intended to fund a year of programming that didn't happen. So I want to.
Oh yeah, but they didn't get a grant for programs that didn't happen. The marijuana grant was a 1-year grant. We just got it. We just did it.
Yeah.
They did not put in for funding, but they were establishing and putting together the program that is opening up January, the beginning of January. Their other programming through NAMI, through the contract review committee, they have done and supplied us with all their quarterly reports and provided programs. So they are two
Okay.
different things.
No, I understand. But I know that, I'm cognizant of the history of Gosnold dipping in and dipping out, and had that concern when we gave them this grant through NAMI, we gave NAMI this grant to work with Gosnold. And so I just feel I feel like it's very important that we're holding them accountable for that grant, especially as we consider another one next year.
I agree.
So, yeah.
No, I agree.
That's what I'm
I
trying to say.
agree.
Yeah.
Yes, I agree 100%.
Yeah.
I'm just advocating what I know as far as going out there and making sure that there was something in process and what their dates were and
Yeah.
and that
I
we
can't
were-
wait. I can't wait to talk with them.
I think
very-
yeah, me too.
Very excited to talk to them.
Me too.
All right, I have to pop off in 2 minutes. Are we going to talk about the food pantry or?
Oh,
Can-
yeah.
Well, why don't we leave that discussion because you're going to be gone and that was a big thing. We'll move it to a next
Thank you.
agenda.
I appreciate that very much.
Okay?
Yep.
You're very welcome. And thanks for coming, Brooke.
Okay, all right.
Merry
See you
Christmas.
all
Merry
next
Christmas,
meeting.
Brooke.
Have a great holiday season. See you next year, everybody.
Yeah, see you next year.
Not
Okay,
if I
bye.
see you first, Brooke.
Bert, do you ever leave that room?
I am. I may be doing a lot of my Zoom meetings with palm trees in the background this winter.
Oh,
Oh,
tough
don't
gig.
even tell us.
All right, bye, everybody.
Bye. So I'm gonna, as said, we're gonna table the food pantry follow-up. And everybody received first quarter reports. Just gonna pull mine back up. Are there any questions in these? We did pay the first quarter reports, quarterlies, because we needed to get them paid within the time period. Sorry. So quarterly reports. I think everybody would have gotten them out should have received them on November 4th and November 5th. Does anybody have any discussions on any of them? So Joanna, what we've done is we established the fact that we would be looking over all of these and approving them, and then allowing them to go forward for payment to make sure that services were actually being rendered, that were being paid for. You do have the ability at any point in time in this grant process to ask for full funding. It does not say anywhere that you cannot get your full funding at one period of time, which you find that Elder Services did. But you still are required to submit a quarterly report for each quarter.
Yeah, I'm familiar with this process.
Is there any discussion on any of the quarterly reports that came in? Bert?
Nope.
Linda?
Nope.
Joanna?
No.
And then there's me, so no. So if there's no discussion and nobody found any discrepancies, Jericho, did you have any discussion?
Nothing particularly large on the today. I think we have to look back around on the NCH data there, and then we're waiting back to hear on the staffing, the labor
Yeah, I'm just-
labor costs.
Right, but I'm
Fair.
talking about the quarterly reports because we were just
Oh
discussing.
yeah, no, I do not have nothing to add on the quarterly reports.
Okay, thank you. No, that's okay. So I'm glad that we approved them, Jericho. And the next ones you will be getting in December, and we will put that on the first agenda of January, so that we can make sure that they're not delayed in any way, shape, or form. I ask that everybody, when they receive them, you should get them by, I'm going to speak out of line. So I'll say that Ann will make sure everybody has them by January 10th. And then
I
we
think
can
they're due like
discuss
the
them.
6th.
Huh?
I think they're due like the 6th or something like that. Yeah, okay.
Okay, so why don't we say January
It's a
12th?
Monday. I know it's a Monday. Because I have it on my calendar on my computer, but they're due on a Monday in January. Maybe the second Monday.
That would be January 10th.
Okay.
So we can say that we can get them out for the January 12th, and everybody to please look at them and make sure that you're okay with them so that we can approve them on the January 12th meeting. Or if we have questions or concerns, let it be known. I believe that is our full agenda. I am just gonna.
Got through basically exactly on time.
There we go. Look at that.
We'd be like 2 minutes early if we hadn't gotten started late.
Yeah, there we go. Right. I said an hour, Jericho. We did it.
Oh, here's Ruthie.
On a refresher, the one thing we will be looking for, Jericho, we just discussed is Jericho and I are going to be looking at a little bit more at the ambulatory care to give a better understanding to everybody. We will discuss at the next meeting the food pantry follow-up, and we'll make sure that gets on the agenda, and we will make sure the information comes out on the grants. I will look again through every grant in case there's any other questions that will come up. And we will, and the one thing I would like to do is have the cannabis grants, if we can schedule the cannabis for maybe, if they could do it, guys, is everybody okay if we make that the 24th? I should have asked with Brooke, but Brooke won't be here for the 19th. It's good to get the other people out in front and then just open up the date of the 24th to everybody. I think it gives them ample time to have somebody available for us.
Okay, so
to
just
present.
off of that, just off of the date of January 24th, just a cannabis grant.
Correct.
Applicants, okay.
Okay. Okay. I think that we did a great job, guys. Joanna, if you ever have any questions, please reach out and we can answer them beforehand.
Okay.
Okay.
Yeah, Joanna, on
Yes.
my first year here, it was like, it was mind boggling, but after a year, it falls in place.
Thanks, Bert.
It's a lot of, I think a lot of it, the biggest thing, Joanne, I have to tell you is it's what I find hard is we have two hats we have to wear. We have a hat that we wear about what we believe and we have passion for and the reasons why they're out there. And we look at that and then we have to, it's what I think a lot of us struggle with is we also represent a whole community. And so we have to put the hat on that we are representing the tax dollars and what is the best way to fund the tax dollars and what is, if somebody were to ask us a question, have we made a responsible decision with the funding to an organization that has proven over and over again, or even just proven once that they're doing what we're funding. And it's really hard sometimes to take your personal passion and put it aside. But I find that this group, we get very animated about what we personally believe in, but we are very good at going for what is really the best buck for the town of Nantucket. And sometimes, I personally have this philosophy. It doesn't necessarily mean the number of people, because sometimes you can fund something, if it saves one person's life, we've done a damn good job.
Right.
And so I think that that's the toughest thing you're going to find as you go through this. Some things might go against core beliefs, some things might challenge them, some things might change them, but we all have to put that hat on as to maybe not what we believe in who we are as our core values, but what are the best values for the town.
Yep.
And that's where sometimes it becomes a great challenge, as I mean, that for me personally. And how to represent it properly and each one of the organizations properly and what they provide, because each and every one of them is pretty damn amazing.
Right.
Yeah.
Thanks,
So,
Dorothy.
yeah.
And the other thing to remember, Joanna, is Dorothy does the yeoman's amount of the hard labor and work on this. We just
Yeah.
ride on her coattails.
Yes, I already knew that. She's come before the finance committee many times.
Yeah, many, many times.
Many times. And she's always well prepared and always well spoken.
Well, thank you. I'm very nervous whenever I do those things, just so you know. Okay, so I believe that we have done everything. I am waiting for a motion.
Motion to adjourn.
Second.
Linda,
Yes.
Bert,
Yes.
Joanne,
Yes.
Dorothy, yay. Jericho, thank you very much. Nice to see you, sir. I will reach out to you about and for further discussion. Okay.
Absolutely. And then also just, I believe Ruthie just popped in a couple of seconds ago. She's the other.
Oh,
member who-
sorry, Ruthie, I didn't see you. My thing
Oh,
is.
it's okay. My internet was acting really bad and it was hard for me to connect. And finally, when I connect, it was like, oh my goodness, it's still a little choppy. Hopefully you guys can hear me.
They're coming through fun.
We can hear you, Ruthie. We have adjourned as a formal meeting.
Okay.
I don't know if you can see everybody that's on there, so at least you get to see a face with everything. Joanna, if you could wave your hand and say hi.
Hi, Ruthie. Nice
Hi.
to meet you.
Hello.
That Bert Johnson. I'm Dorothy. Hi, Ruthie. I think you know Brooke. I don't know if you know Linda Williams. She does not have her a video available.
It's okay. Linda sounds familiar, but maybe next time.
Next time. And then I think do you know Jericho?
Yes.
Okay. So we're sorry that we missed you. We did set up were you there to hear the schedule?
Yeah, you said January 19th.
No, January 5th, we begin. January
Oh,
5th at 10 a.m. And so what the process is, I think I'm just going to explain a process. Am I allowed to do that, Jericho? So that
You
she
are.
understands? Okay. So what will happen is the people that have applied for the grants will come in they will Zoom in with us and present their packets. They will present either on the 5th, the 10th, the 12th, or the 19th. And that will be presentations. So what we do is we have them come in, any questions you might have after reading their packets, after their presentations are presented to them. And we use that information in our deliberations. Those will happen on those 3 days or 4 days. The 24th will be the marijuana grant, which is a completely different grant, but we are overseeing that grant. And then most likely the 26th will begin our deliberations and discussions as we go forward in deciding on where the grants will go. And I should have asked Joanna, I did not ask her. I don't know when, and if she finds out, if you could let us know when they're thinking that we're going to present.
I don't know yet.
Okay.
We have only had one meeting. Our next meeting's on January 10th.
Okay, great.
So it'll probably be, my guess is end of January, beginning of February.
Oh, let's hope mid-February, end of February that they ask us.
Okay. Well, I can help with that.
Okay, thank you. So the deliberation process is a great discussional process between all of us. We go out to the sites afterwards, sometimes because there could be questions that come up from everybody. And once those questions are answered, we come back and we discuss what we've heard. Some people, it changes your mind after you go in. So it's always good to pick an organization that you have a lot of questions about if you want to go on to the on-site, because that's where you're going to get your questions answered.
Okay.
And it's a very interesting process. I think you'll enjoy it, Ruthie. It's a bit challenging at times, but it's well worth it.
Awesome.
So we look forward to it. I'm sorry that we missed you. Great photo you've got here, and we'll see you. We'll make sure that you're in with us on January 5th.
January 5th. And is that going to be 10 a.m.?
It is. All the dates are 10 a.m. and I'll have Ann send you an email with all that. And Ann will send out an email today confirming all the dates that we put out there.
Awesome. Thank you so much.
You're welcome. Thanks, Ruthie. I'm sorry about your connection to us.
Oh, no worries. I'm going to try to be inside of a building because I was out on the road. So that may have contributed to that.